Tonight we're discussing universal access to healthcare. Now, in 2003, government introduced the National Health Insurance Policy as a social protection safety net for the poor and vulnerable people who could not afford healthcare during the then cash and carry system. Now, 6 years on, in 2009, the National Health Insurance Authority, NHIA, reported that the coverage level was at 67%. But of course, civil society groups debated that the coverage could be much lower, could be at around 18%. Now, 7 years on, in 2010, the NHIA's own annual report put the coverage figure at 34%, which actually means that about 50% or more people are still unable to access healthcare or are seeking healthcare through a cash and carry system. And then also out-of-pocket payments are still more than twice the WHO recommended proportion of total healthcare expenditure of about 15 to 20%. Majority are still unprotected from catastrophic health events. Now, tonight I have with me representatives from the Universal Access to Healthcare campaign. It is a campaign which is engineered by international and local NGOs with the aim of making access to healthcare services free at the point of use. Some of the questions we'll be putting to them is, do you think the NHIS could be used to achieve universal access to healthcare for all Ghanaians? Is a tax-based funding the most appropriate for the National Health Insurance Scheme? And is there any alternative to sources of funding other than tax? My guest tonight is Hor Sidua. Sorry, I'll start with Jonathan Dabre, who is at my immediate left. Jonathan is policy analyst from ISODEC, the Integrated Social Development Center. And then next to him, I have Hor Sidua, who is the national coordinator of the Universal Access to Healthcare campaign. And then next to him, I have Nana Kofi Opong-Damoah, who is policy analyst for the MPP. We'll talk through some of these questions and many more. You can join us by text 1760, or you can post your comments on our Facebook walls. Welcome, gentlemen, to PM Express.
Thank you.
Universal access to healthcare. Let me start with you, Hor Sidua. Do we have a problem as a country in making access to healthcare entirely free at the point of use?
Thank you.
So we need to you swap the position.
Yeah, swap the position. Okay. Yeah. All right, Jonathan.
Basically, universal access to healthcare is ensuring that all those residents in the country have access to healthcare as and when they need it, free at the point of use, such that no one is left out at the time that person needs healthcare. As a country today, we say that more than half of the total population still cannot access healthcare, or have to do so with difficulty because they have to take money from their pocket. And I must say that this is not only today. We have come a long way as a nation, but it was also good that government took the bold step to introduce the National Health Insurance Scheme as a way of protecting the poor, especially from the catastrophic effect of
cash and carry.
Cash and carry. So it was a hope of the country that about 9 years down the lane, we should have about 70 to 80% of the population, especially the poor, having access to healthcare. But as we talk today, that is not the situation, as you indicated in your synopsis, that about 34% of the population are covered. That is the active members. So the National Health Insurance Scheme, in its current form, cannot ensure universal access to healthcare unless it is reviewed, unless we look at it very well and then try to look at other ways in which we can ensure that there is high coverage and there's financial sustainability.
Now, Jonathan, you mentioned that in its current form. What is the current form of the National Health Insurance?
Yes, I'm Hor, not Jonathan. This
sorry,
is Jonathan.
okay,
yes.
Sorry, I beg your pardon.
Yes. Oh. When I talk of the current form, we still have majority of the population, that is the poor, especially those who live in the edges of the country, not having access to healthcare. One, quite a number of them are not able to pay. Two, some live in communities that do not have health facilities. So for a person that is living in a rural area that has struggled to pay the national health insurance premium, that person may not have a health facility to attend, or may go to a nearby health facility that hasn't got a qualified nurse, a qualified doctor to attend to that person, relative to a city like Accra, Kumasi, Takoradi, Sunyani, Tamale, that have health facilities with a lot of medical doctors. You know very well that in this country we have most of the medical or trained health personnel living in the cities. So for example, if I were living in a very remote village such as Brahebekumi in Aguna East, or a place like Sandima, and I buy the same health insurance, and I go to a health facility and there's no trained doctor or there's no trained nurse, and then my colleague in Accra buys the same national health insurance scheme and probably goes to a range where there's a doctor or a nurse, trained nurse to attend to him, then I say that this is unfair, because you buy insurance hoping that in the situation that you fall sick, then you have access to basic health care. But the situation, that's not what we are. I'm waiting that we have the opportunity as a nation to ensure that everybody in this country can have access to basic quality health care free at the point of use. We have the opportunity to do so.
No, I will still press on a little bit with you. I mean, what are the indications? What indications do you have about who and who are not accessing healthcare? And what figures are you putting out? What are your evidence, really?
Yes. From the National Health Insurance own record, that is their annual report, it shows that as of 2011, only 34% of the 24.3 million population have active NHIS cards. That means that the remaining 56% of the population probably are not covered. Now, of this 56% of the population, you may have some people who are on private health insurance. So let's even say that we take 10% of the 56. So that was going to come to like 46% of the total population still uncovered. Now, from these records, we also realize that from the research we have carried out that of those who are having active cards, majority of them are in the upper quintile, wealth quintile. So that means that those who are even having the national health insurance card are relatively better in terms of their economic well-being. So it means majority of the poor for which the scheme was introduced to protect are still left out. And this is the concern of civil society. We think that yes, it's good, it was a bold measure, but we need to move it further. We need to probably review the whole system and ensure that many more people are covered. Because there are questions that are, why is it about 9 years down the lane, we still have coverage figure being 34%. I remember somewhere in 2010 when we launched our report, that is Achieving a Shared Goal, Free Universal Access to Healthcare, the National Health Insurance Authority challenged us that the coverage was around 67%. If it was so, then today we should be talking about 80, 70,
to 90%.
Now, we told them that their methodology was flawed because they were doing cumulative figures, they were doing double counting. And then over time, they probably looked through it. They disputed initially and issued a lot of press releases debunking the report. But today we are happy that they have gone back, they've gone through it, they've reviewed it, and now they are separating active members from those who have registered. And now that is the reason why the figure has come down to 34%, not too far from the figure. So it means we were very right. And we are happy. It's not about who is right, who's wrong. It's about getting a healthcare system whereby everybody in this country can have access to healthcare. And it's good for it to be honest. As an institution of state, like the National Health Insurance Team, it's good that they are being more open, transparent, and then they are honest. So what we're saying is that, yes, let's look at it. How can we sustain it? The CEO, that is Sylvester Mensah, in July this year in Tunis, he made a presentation here. He did admit that the National Health Insurance Scheme is not financially sustainable. In their 2010 report, they did admit that unless other sources of funds are sourced, the scheme risks collapsing. So this brings the issue, how as a nation can we ensure that, one, we have finance, we source funds internally without relying on any donors to make sure that the National Health Insurance Scheme is sustainable, to make sure that we have a lot of resources to expand the existing infrastructure, to equip the existing infrastructure and make sure that many more people, especially the poor, are covered.
Right, Jonathan, what is ISODEC's own assessment of the status of access to healthcare in Ghana?
Thank you very much. Well, ISODEC is a partner to the Essential Services Platform. And we're co-authors of the research report that Sidiaho referred to. The health system in Ghana is seriously challenged, and there's no doubt about that. We
also are of the view that
yes,
it's not financially sustainable.
It is not financially sustainable. The current practice of relying on premiums, people having to access health based on the payment of premiums, is not equitable. If you assess the health sector, health systems in Ghana, financing is just one component of all the 6 building blocks of a health system. Financing in the sense of revenue generation, in the sense of efficient utilization of those revenues, in the sense of providing coverage to all those who will require health care whenever they are sick or in need of it. So when you look at the current practice, the assessment that has been done on the National Health Insurance Scheme, it is clear that in terms of access, as Sidiaho indicated, 34% of the Ghanaian population are covered by the insurance system. That clearly indicates that in terms of coverage, on the principle of universal coverage, we are not covering a lot of the citizens of Ghana. Even out of the 34 that are covered, the higher percentage of that comes from the upper income quintiles. And the rural populations, the poor and marginalized groups are not accessing health. If you move away from just the coverage to services utilization, you find out that it is the upper class, the rich, that are able and that are accessing and utilizing the health services. So that straight away ties coverage to utilization. We've done the analysis of satisfaction of the use of services, and across board, there's the understanding and there's the appreciation that the Ghanaian citizenry are satisfied to some extent with the kind of health services that are provided. But without coverage, without access, certainly a lot of Ghanaians are denied access to health care.
So, Jonathan, tell us. I mean, let's focus on the aspect of money flow into the National Health Insurance Authority or the scheme. I mean, we know contributions come from NHIL. We know SNIT makes a contribution, and we know NHIS, I mean, individual premiums, all contribute to the pool of money to sustain the scheme. You don't think this is enough? I mean, for you to hold a view that the scheme is not financially sustainable is very worrying.
Well, the scheme is fraught with so many challenges. The bureaucracy.
Some of it includes bureaucracy?
Yes, it is heavy. You have 140 something plus mutual health insurance schemes. That draws funding and financing from the insurance fund for administrative. Just imagine the administrative setup of the insurance scheme. Each district, each municipal insurance, scheme draws staffing salaries, operational cost, financing.
All from the NHIS.
All from the NHIS. So it is heavy, it is bureaucratic. Now, you ask yourself, if you want to extend coverage, universal coverage of healthcare to all Ghanaians, and you are spending so much just to take care of administration, salaries, certain allowances, fuel, and all that. It is clear that that kind of program is certainly not sustainable. So we have systems, we have practices elsewhere that healthcare is funded mainstream. So our position...
When you say funded mainstream, what exactly do you mean?
Well, you align the financing mechanism to the health system delivery mechanism.
How?
The Ghana Health Service, the Minister of Health, through Ghana Health Service, is delivering health care to the citizens of Ghana. The financing mechanism should be mainstream within that context, so that you don't have set up a separate entity with heavy administrative setup, drawing funding from the health sector, which could have been used to supplement the people providing the health services. The Ghana Health Service, the regional, the district, and Ministry of Health. So we do not think the current setup is sustainable, and it is not an argument against the health insurance fund. Our argument is not that the health insurance fund is not good. Our argument is we can actually have the 2.5 VAT levy that goes to the insurance levy, the SNIT contribution, and sort of possibly what the current government sought to do, the one-time premium. But in all that, you have to find a way to use progressive tax instrument to raise additional funding to support the health sector financing, to support the health insurance fund, to take care of the health needs of Ghanaians. So it is not an argument against health insurance, I mean the fund. It is an argument against the fact that when Ghanaians have to access health, you must necessarily hold a valid insurance card, which is
Otherwise,
issued,
you could lose your life.
which is issued every year based on the payment of premium.
Okay.
So that is the crux of our argument.
Jonathan, I'll come back to you so that you walk us through, you just raised an issue about progressive tax instrument. Yeah. I'll come back to you and we'll explore that. Let me come to you, Nana Kofi Damoah. The NHIS was introduced in 2003 under the supervision of the NPP. The NPP's tenure was when the National Health Insurance was introduced. Looking back, how do you feel about the current state of the National Health Insurance?
Stephen, two things are very important and very critical in the discussions of matters surrounding the National Health Insurance Scheme. I would have to repeat some facts that civil society have made very clear tonight. One is the fact that we need to be honest in our dealings with the people of the Republic of Ghana in these matters. We need to be very honest at all material points in time when dealing with these matters, because
you don't think the operators of the National Health Insurance Scheme have been honest?
There.
Okay.
Now, they have clearly stated that the active users is what is key. Recently, we've been bombarded with a lot of figures amounting to somewhere around 22 million cedis being some. I've forgotten the caption that they put on it. Utilization. I've forgotten exactly the caption. Now, you see, when you look at the reporting system, in 2008, the NHIA, that is the National Health Insurance Authority, as by law, caused to be laid before Parliament a report in 2009. So the report that was presented in 2009 was to cover 2008. And they said utilization was 9.9 million. Come to 2010, the report for 2010 was presented to Parliament in 2011. The figure they gave was 8.1 million. Come to 2011, that report should have been presented in Parliament by now, because we are in October 2012. That report has not yet been presented to Parliament. And the figure in there is 8.2 million. Clearly, when you pick 9.9 million in 2008, and juxtapose it to 8.1 million in 2010, and 8.2 million in 2011, there's a decline. Honesty demands that we'll come out to the people of Ghana and explain to them that, look, we have a problem. People are not utilizing it the way we expect that they will utilize it. And these are the challenges that the system will face. So that the entirety of Ghana will address our minds to the issues as they stand and look for solutions in a concerted effort. Rather, what we are being told is that 22 million for some term. And I've forgotten the term. That's where the problem is. My brother, you see, the thing about National Health Insurance is that they have spoken rightfully about financing and statutory methods of financing and all of that. You need to understand that the funds that support the National Health Insurance Scheme are statutory funds. Those funds have been carved out by law, and there's nothing that can be done about those things. Unfortunately, due to excessive bureaucracy and the other bottlenecks that we have in the system, you'd realize that the monies are not paid on time. Ministry of Finance delays a lot before it releases these monies. But the global rule is that you should not wait for up to 3 months before service providers are given their monies. And this is because if service providers provide the drugs or they provide whatever services that are needed, and it takes 3 months, it means for those 3 months, the service providers are continuing to rely on credit. And at a point in time, surely their creditors are bound to get, dissatisfied with the situation, and we are likely to have serious problems with such a system. Take this very year alone. After the payments, after disbursements in April, the next tranche of disbursements that came was 2 weeks ago in September. That is 5 months. A huge 5 months delay. Now, if the global rule says that you are not supposed to go beyond 3 months for a scheme of this sort, and bear in mind the fact that this is the largest social intervention scheme that has ever been done in Ghana over the last 40 years. It's a very ambitious project. Let's nobody deceive himself. So if you're running such a scheme and you allow payments to lag behind for more than 5 months, then in effect, you are collapsing the scheme.
If the money is not there, if the money is not coming, how do you pay?
My brother, this is the point. They are statutory funds. You can't tell me the money is not coming.
So do you have an idea how much
the
statutory
only reason
comes into the
why
fund?
Monies would not be paid, and we can blame money not being there, is that the Ministry of Finance is not working hard enough to release the monies on time. And if that is the case, any government that is committed to health of the people should have ironed out these bottlenecks within the last 3 years. Unless we are being told that the Republic of Ghana is so bereft of expertise that within 3 years we cannot iron out bottlenecks in release of statutory funds for nonetheless anything but health, which is a very critical aspect of it, because you see, you need a working workforce. Forgive the tautology. You need an able workforce. You need a workforce that is healthy to be able to even develop. Basic point. So if the Ministry of Finance or whatever ministry is responsible for these things has not been able to iron out whatever bottlenecks over the last 3 years, then there are serious issues that must be addressed. But going back to the point, 2 major issues. Number one, clearly there are indications that the system is failing. And it is about time that we all admitted that the system is failing and started looking for solutions to some of these problems. I believe that when we come around, we can start looking at solutions to these issues again. And number two, the fact that we need to acknowledge some of these problems so we can work on it. And how do we work on it? By ensuring that the necessary problems, which they have identified. And I'm very happy about the fact that they've identified these things, because if I did, then it would go into the realm of politics as usual, and claims and counterclaims, and it is A and it is B. But now that civil society has identified these problems, I hope that we'll have a discussion aimed solely at dealing with some of these problems. But for us, the key point is that let us admit that there's a problem. Consistently over the last 3 years, we have been hinting on the fact that, look, all is not well with the National Health Insurance Scheme. And our reason has been very basic. In 2003, when the law was being passed, the NDC, the government of the day currently, stayed away from that vote. They believed it was impossible, and they said it could not be done.
But I mean, let's move it from there. I mean, it has been done. Now we have a viable national health insurance system. Moving on, how can we make it better?
Thank you
with
very
all
much.
the problems?
But the history is quite relevant, and I'm come to show you why the history is relevant. With that background, the system was implemented. We moved forward. We still went ahead and implemented it anyway. It worked for 6 years. When we were exiting office, we had a utilization of 9.9 million.
But there were still challenges when
there
you
were
exiting
still challenges.
office.
But
and the NDC accuses the MPP of negligence and
Here's
lots
my
of
point.
other things bordering on corruption,
Here's
which
my
didn't
point.
make, which obviously meant that you handed over a very, very weak national health
Here's
insurance
my point,
system
and
already.
that is why the history is also very important. Challenges or not, we were committed to it. And that's the key thing. Challenges or not, we were committed to the policy. We were committed to the program. And we believe that implement it and iron out the difficulties as they come.
So you do admit that you were part of the problem to start
My
with.
brother, there's nothing like a perfect system anywhere in the... I don't think that civil society would say that there's a perfect system. Every system, as you go through the motions, throws up its own challenges. The key is a commitment, diligence to solving the problems as they come. But if you have a governance group that believes that it is impossible from the word go, then when the challenges come, the easiest thing to do is throw your hands in the air and say that we told you it's impossible.
Well, you're watching PM Express and we're discussing universal access to health. We'll take a short break, and when we return, we'll get onto the phone line and speak to Ameto Kwame from the National Health Insurance Policy for his reactions to all of these issues that have come up. Stay with us.